Besides taking medication, this question is from Sylvia Ang. How does one live with or accept physical pain and discomfort arising from a chronic illness? So, besides taking medication, well, in the West, interestingly, it's been maybe some 20 odd years, 20, 30 odd years, there's this program called MBSR, Mindfulness-Based Stress Reduction Program. So it started off with cancer patients where they are given pain medication, and to a certain point it stopped to have lesser and lesser effect. So I think one of the doctors or something, Harbad Singh, and so I think he's a Myanmar, and he introduced mindfulness meditation. Yeah. So MBSR, Mindfulness-Based Stress Reduction Program, is directly pulled from the mindfulness practice, and is largely based on the Satipatthana Sutta. Yeah. So that is actually a well-documented approach, yeah, for using Buddhist meditation in relation to physical pain. Yeah. And from what was written, the patients who are, I don't think any of them are Buddhists, and they just, and it's not as though they were meditators to begin with. Yeah, they were taught simple methods of awareness, mindfulness, and bring the attention to the breath, bring attention to the pain itself. Yeah. So this is something that is, I think, quite unique in Buddhism, that instead of running away from the pain, before there's pain, to train ourselves to be able to be mindful, to be aware of our body and mind. Yeah. And then, there's the four foundations, right? Sen So Xing Fa. Yeah. So body, feelings, mind, and mental objects. Then, such that when pain does arise, we are able to face it. We are able to observe it, to be aware of it, without being averse to it. Some people say embracing it. I like to perhaps highlight that it's not so much embrace as in liking it. Yeah, I don't think we should be liking pain. I think that would become masochistic. Yeah, but rather to be able to accept that pain is part and parcel of life, that the pain that arises is part of the nature of this body. The body, with all the senses that we have, in particular the physical sense of touch, is the largest organ, the sense organ anyway, is capable of giving us painful, pleasant, neither painful nor pleasant sensation. Yeah. This is taught by the Buddha. Yeah. This is not something new that we borrow from medical science. This is something that is taught in the suttas directly. Yeah. And this practice helps us to in a way come to terms with it, but more about acceptance. Yeah. More about kind of like learning to live with this other aspect of our body. Because if you think about it, nobody actively go and look for pain, right? Yeah. But we do actively look for pleasure. For the most part of our daily life, our body gives us neither painful nor pleasant sensation. Occasionally, we go from the hot outdoors to the room with aircon, then we feel, oh, nice, chill. But after a while, that chill, we become acclimatized to it, normalized to it, and then we don't feel much. Yeah. Then maybe we feel too cold. That same cold now start to hurt us. We start to feel uncomfortable. Yeah. But we are usually also not really aware what that discomfort is, because we very quickly put on sweater lah, put on jacket lah, adjust the aircon lah, or turn off the aircon. We are constantly trying to change our experience to regulate it, which is no crime and shame, but as a result we miss out on the chance to learn more about the experience. So in the Buddhist practice, it's about learning more about this experience, knowing more, and through this direct knowing, direct seeing, then the way we relate to it becomes transcendent. It transcends the usual likes, dislike. And so that's how the practice can help people to live with or accept physical pain and discomfort. And I think this is something that is very helpful for people to learn to do even before they have any chronic illnesses. In fact, I would say even better if they start before that. But the trouble is sometimes, no pain, no itch, then no impetus.